Hello, my name is Jonna Cowles. I have chosen to review the impact of yoga therapy in trauma victims, especially individuals with PTSD. As we all know, PTSD is a mental health disorder that follows a witnessed or experienced life-threatening event or events. Individuals have a hard time self-regulating due to the activation of the sympathetic nervous system. Therefore, they stay in the fight or flight response. This can be debilitating and have a negative impact on one's quality of life. Some of the common events are combat, natural disasters, terroristic incidents, physical and or sexual abuse, neglect, and serious accidents. PTSD facts include 60% of men and 50% of women experience at least one traumatic event in their lives. 7 to 8% of the population will have PTSD at some point. About 8 million adults have PTSD in a given year, and about 10% of women will have developed PTSD at some point in their lives compared to about 4% of men. Individuals diagnosed with PTSD are symptomatic for 6 months to years despite therapy. According to the U.S. Department of Veterans Affairs, there are 4 types of PTSD symptoms. First is reliving or re-experiencing the event through bad memories, nightmares, or flashbacks. Second, avoiding situations that might trigger their memories. They want to avoid talking or thinking about the event. Third, negative beliefs and feelings, such as self-perception and perception of others, feelings of guilt or shame, and they lack trust, feelings, or interest in activities that they used to have pleasure in. And fourth, hyperarousal. These victims are constantly on alert or in a heightened state. They have trouble concentrating or sleeping. They feel angry, irritable, and they are easily startled. And they develop unhealthy habits such as smoking, drinking, and using drugs. Given the prevalence of trauma exposure in our society, it is crucial to have effective treatment options for trauma victims. There are currently 3 treatment options for PTSD victims. First is psychotherapy. Trauma-focused psychotherapy focuses on the memory of the event, and this has been seen to be the most effective. Cognitive processing therapy. Skills are learned to understand how trauma changed one's thoughts and feelings. Changing how you think about the trauma can change how you feel about the trauma. Prolonged exposure. Repeatedly talking about the trauma until memories are no longer upsetting. This allows the victim to take control over their thoughts and feelings in regards to the trauma. Eye movement desensitization and reprocessing involves focusing on sounds and hand movements while you talk about the trauma. This helps your brain work through the trauma. Second is medications. There are 2 categories of medications used for PTSD: SSRIs and SNRIs. One important fact to note is that benzodiazepines and atypical antipsychotics should be generally avoided because they do not treat the core PTSD symptoms and they are highly addictive. Third is combination therapy with psychotherapy plus a good medication regimen. An essential aspect of recovery for trauma victims is self-regulation and learning ways to calm down and cope. So the proposed practice change is yoga therapy for PTSD victims. Yoga therapy is a practice that helps calm the mind, body, and spirit. It leads to a sense of peace and well-being. Yoga practices include meditation, relaxation, physical postures, reduction in the sympathetic activation response, muscle tension, emotional distress, and it improves the quality of life. After reviewing and synthesizing research articles, research evidence has shown that trauma-focused psychotherapies have been ineffective for trauma victims, especially with PTSD. 45% of therapy received for PTSD, victims remained significantly symptomatic after treatment. Two-thirds of those who responded to the initial therapy eventually relapsed within 6 months. The researchers' recommendations: overall, yoga therapy has made a positive impact on mental health issues. They also recommended that yoga therapy can be used as monotherapy or adjunctive therapy, especially for PTSD victims. The implications for practice change are shown by the benefits of yoga therapy based on statistical significance. First is increased self-worth. Second is improved self-regulation of thoughts and emotions. Third is a positive effect through empowerment, control, safety, and the healing process. Fourth is improved sleep patterns due to the reduction in nightmares. Fifth is reduction in reliving or re-experiencing the event. And last is a reduction in the hyperarousal and the startle response state. This is my evidence-based presentation for yoga therapy in PTSD victims. In conclusion, psychotherapy plus a good medication regimen plus yoga therapy equals improvement in overall well-being in PTSD victims.